Hello, everybody. My name is Israel Balderas. I'm an assistant professor of journalism here at Palm Beach Atlantic University. Thank you so much for joining us in this presentation. You know, as the world races to find a vaccine and a cure for COVID-19, there's seemingly no antidote in sight for the growing outbreak of coronavirus. Conspiracy theories, hoaxes, anti-mask myths, and sham treatments. It appears that misinformation on coronavirus is proving highly contagious. That is why I am joined today by Jill Brayton Balderas. Yes, we do share a last name. We are married, and we also happen to be former journalists. Jill covered health, news, and policy in Washington, D.C. for many years, and she has a master's of public health in epidemiology from George Washington University. Jill, thank you so much for being with me today.
I'm happy to join you.
You know, Jill, experts worry about the torrent of bad information. They say it is dangerously undermining efforts to slow the virus. And now the number of people who have died from COVID or COVID-related has now surpassed 150,000. Let me just show folks the latest numbers as of this recording. Here in Florida, we have almost 500,000 confirmed cases. 7,400 people have died. In the United States, the number is the number of confirmed cases is almost 5 million, with close to 160,000 people who have passed away. And then worldwide, 18.6 million confirmed cases, with 701,000 people who have died. Those are sobering numbers.
They are sobering numbers. And I also just like to add too, is that this is what we've been able to count worldwide. There are likely many more people who have actually had COVID-19. And that's something that we'll get into a little bit later, how these statistics are measured.
And that is why we have put together this presentation. We are calling it Tackling the COVID-19 Infodemic, how journalism responds to pandemic confusion, because there is so much unknown still, even with these past few months of not just COVID-19, but how it's impacting communities around the world. You know, these are going to be some of the definitions that we are going to use today to make sure you are better informed.
So essentially, this is a novel virus. It's called the novel coronavirus. More specifically, is SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2. So that's actually the virus that causes the disease, which is COVID-19, which is basically named after the year that it was discovered, 2019. We'll also discuss misinformation, which is false or inaccurate information shared accidentally, then disinformation, which is false or inaccurate information shared deliberately. Now, we don't always know people's intentions, but we can, through especially things that are shared on social media, we can look at how different videos are actually associated with groups that specialize in disinformation, or at least focus on spreading disinformation for their own purposes.
And here's the presentation that we are going to provide for you, because I think the theme is going to be today that misinformation helps spread SARS-CoV-2, and we are going to show you how that is done. Here's how we've broken down our presentation. We've broken it down into 3 parts. The first part is going to be trust in the media, because before COVID-19 overwhelmed our lives, trust in the media was at a low point. And what we're going to show you is that that was fertile ground for creating this environment where people either don't trust or don't know where to go to get accurate information. Then we're going to try to separate fact from fiction, because throughout these past few months, the federal government's reaction to it At times, they've had mixed messages. Sometimes we've had evolving scientific understanding. And then we've struggled to distinguish at times between what is the truth and what are rumors. And finally, section 3, towards the end, we're going to give you some recommendations on what you can do so that you are better informed about this worldwide pandemic. But as we say always, Jill, let's start at the beginning. In this case, we are going to start somewhere a few months before the beginning, because right before COVID-19 overwhelmed our daily lives, trust in mass media by the public was at a low point. It wasn't a record low, but it's still worrisome. In a Gallup poll taken in September of 2019, Americans were largely mistrustful of the mass media, as 41% had a great deal or fair amount of trust in newspaper, television, and radio to report the news fully, accurately, and fairly. 58% said not very much or none at all. Now, if you separate the data by political affiliation, 69% of Democrats said they had trust and confidence in the media, while 15% of Republicans and 36% of independents agreed. Now, in our current highly politicized climate, the views of political partisanship has become increasingly divergent. President Donald Trump's description of the media as the enemy of the people has undoubtedly colored many Americans' view of journalism. Fox News is the only national news source with majority-level trust from Republicans, while majorities of Democrats trust a variety of news sources: radio, network news, major newspapers, and CNN. Another Gallup poll taken in August of 2019, when you rank the order of partisans' trust in the accuracy of news and information across party affiliation, Republicans by 72%, independents by 70%, and Democrats by 82% trust local television news ranks first. And then that is followed by either discussion, local newspapers, and then nightly news on ABC, CBS, and ABC. So with that in mind, let's look at the timeline of how the SARS-CoV-2 pandemic unfolded. Jill?
So we first started hearing reports of this novel coronavirus at the end of December, beginning of January here in the United States. So Israel, if you want to go to the next slide. So on the 31st of December in Wuhan, China, health authorities confirmed that they were treating dozens of cases. And on the 11th of January, the Chinese media first reported a death from the illness. And we also just want to make a note too, is that the Chinese media is not a free media. So it's definitely controlled by the government, and information that is definitely kept under wraps. So that's just something to note, unlike what we have here, which is the media is not controlled by the government. So then moving on a little bit later on in the month, January 20th, the first cases were confirmed outside of mainland China, in Japan, South Korea, and Thailand. And by this point, it was definitely on everybody's radar here in the United States, given our global society and how frequently people travel. It was only a matter of time before we knew that something like this would end up in our country. And sure enough, on the next day, we had our first confirmed case here. A man in his 30s in Washington State developed symptoms after returning from China. Can you go to the next slide? So Wuhan, China, as you know, just from what you've heard in the media, is an enormous city, has more than 11 million people. And they closed off that city. During this time, they were getting ready to celebrate the Chinese New Year, and the government in China really clamped down on travel. And they closed off the city on the 23rd of January. And the next day, the Chinese CDC confirmed that there were 830 cases and 25 deaths so far, which was highly likely that that was a low count. But this, again, was a novel disease. It had a lot of the presentation symptoms like the flu. So at the time, they were still trying to gain a foothold on understanding exactly what this disease was. So Nepal, Vietnam, France, and Malaysia confirmed their first cases on the 24th of January. And on that day, the United States confirmed its second case. On January 25th, its third case. 5 days later, the US confirmed a sixth case. And as the authorities had concern that there would happen, basically there was the first person-to-person transmission of coronavirus in the country, which means that it was not a travel-related case of someone going to China and actually acquiring the disease there, or the infection there. It was actually passed on from US citizen to US citizen. On January 30th, the World Health Organization, the WHO, said the outbreak now meets the criteria for a public health emergency of international concern. So here's a look at the Trump administration's response. On the 31st of January, Trump suspends entry into the US from China. Into February, on the 4th, Trump pledges to safeguard Americans from SARS-CoV-2. On the 13th of February, the US CDC director says the coronavirus will likely become a community spread virus. And the 29th of February, the US reports its first death. Now, we do know now, looking back and being able to actually look at blood work of other deceased, that actually was not the first death. There were at least 2 other deaths prior to that that were associated with COVID-19.
Now, what we're going to show you at this point is what the administration said and did. So we're going to show you a video of President Trump's reaction.
And this is over the course of many months. And the reason why we show you this video is to illustrate partly why Americans are confused, because the message that President Trump was sending was different from what the health authorities were sending.
Okay, so this is from the Washington Post. And as you see the headline there, this records the 54 times that Trump downplayed the coronavirus. Keep in mind, you will see the dates when he speaks.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. We think we have it very well under control. We pretty much shut it down. A lot of people think that goes away in April. With the heat, we're in very good shape. I think it's going to work out fine. Very well under control in our country. I think that's a problem that's going to go away because of all we've done. The risk to the American people remains very low. I mean, view this the same as the flu. It's going to disappear. One day, it's like a miracle. It will disappear. We are working on cures, and we're getting some very good results. We only have 15 people, and they're getting better. Now the Democrats are politicizing the coronavirus. And this is their new hoax. If you're healthy, probably go through a process and you'll be fine. You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona? No. Some of them go to work, but they get better. It'll go away. We're doing very well, and we've done a fantastic job. It will go away. Just stay calm. We have seen dramatically fewer cases of the virus in the United States than are now present in Europe. It's going to go away. 1.4 million tests on board next week, and 5 million within a month. I doubt we'll need anywhere near that. It's something that we have tremendous control of. I think we're going to win faster than people think, I hope. Parts of our country are very lightly affected. You're going to lose a number of people to the flu, but you're going to lose more people by putting a country into a massive recession or depression. They have to go back to work. I think it's going to happen pretty quickly.
I don't believe you need 40,000 or 30,000 ventilators.
2.2 million deaths. If we could hold that down, as we're saying, to 100,000, it's a horrible number. We all together have done a very good job. Stay calm. it will go away. You know it is going away.
We think the death will be at a very low number.
It's going to go away, hopefully at the end of the month. If not, it hopefully will be soon after that. Our states, generally speaking, they're really flat. The CDC is advising the use of non-medical cloth face covering. It's voluntary. You don't have to do it. It will go away. There are certain sections in the country that are in phenomenal shape already. Other sections are coming online. Other sections are going down. Hard to believe that if you had 60,000, you can never be happy. But that's a lot fewer than we were originally told. It may not come back at all. This is going to go away. It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated. Will some people be affected? Yes. Will some people be affected badly? Yes. But we have to get our country open.
Lives will be lost to reopen the country.
It's possible there will be some with or without a vaccine. It's going to pass, and we're going to be back to normal. This virus is going to disappear. I feel about vaccines like I feel about tests. This is going to go away without a vaccine. We prevailed on testing. If we didn't do any testing, we would have very few cases. At some point, it'll go away. Many of these people aren't very sick, but they still go down as a case. If we stop testing right now, we'd have very few cases, if any. It goes away.
It's going to fade away.
The numbers are very minuscule compared to what it was. It's dying out. Many call it a virus, which it is. Many call it a flu. What difference? Got to get it open. People need it. You know, people get sick from the other also. It's not just.
So that was President Donald Trump 54 times downplaying the coronavirus. It would go away. If they can keep it to under 60,000, 100,000. And again, the theme was the thing is just going to go away. Now, it wasn't just President Donald Trump who was reacting to the coronavirus during this time. You had other health officials, Jill, who were also talking about what the American public should expect as this virus would spread throughout the United States.
That's right. So the first one is Dr. Nancy Messonnier from the CDC. She issued a blunt warning on February 25th. And Israel is going to bring that audio up.
So I want to show something if I can. So this is February 25th. This is President Donald Trump. As you can see from the flag to the left, that is the Indian flag, the country. And he was on a foreign trip visiting India. On that same day, Dr. Messonnier from the Centers for Disease Control and Prevention was on a phone conversation with many reporters. And as you can see here from the headline, this was a press briefing by her updating what was going on with COVID-19. So what you're about to hear is her voice over a speaker.
To date, our containment strategies have been largely successful. As a result, we have very few cases in the United States and no spread in the community. But as more and more countries experience community spread, successful containment at our borders becomes harder and harder. Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness. We will maintain for as long as practical a dual approach where we continue measures to contain this disease, but also employ strategies to minimize the impact on our communities.
So that was Dr. Messonnier. At the same time, President Donald Trump, Jill, he's on a foreign trip. And according to the New York Times, Mr. Trump was walking up to the steps of Air Force One to head home from India when Dr. Messonnier issued this blunt warning that several health officials believed was necessary. But the news reports indicate that Mr. Trump fumed as he watched the stock market crash after Dr. Messonnier made those comments. Trump, according to the Wall Street Journal, also threatened to fire her from the CDC altogether. So after that, we don't hear any more public comments from Dr. Messonnier. At that point, the White House created the coronavirus task force, and all messaging, regardless of what was going on, would go through the White House and the spokesperson, who was Vice President Mike Pence.
Right. So just to kind of focus in on what was important about what Dr. Messonnier said is that she said it wasn't a matter of if, but when community spread happens. And she also later on in the call said that she had already had a discussion with her own family saying, look, our lives are very likely about to dramatically change, and we need to be prepared for that. So essentially, because there was this new infectious disease that people were still just learning about, that proved to, or appeared to be highly transmissible, and the reports that we were getting out of China also seemed to be quite deadly. Now, in actual fact, the fatality is lower than what we thought, but what we were hearing out of China was that it was potentially as high as 5%. That is not the case, and we'll talk about that a little bit later, how that's measured. But she was essentially sounding the alarm that, hey, this is going to start to get quite serious, and we need to be prepared, which was the opposite of what we were hearing at that time from President Trump.
And she wasn't the only health official who was saying this. So this video is from February 26th. This is when the White House announced the creation of the Corona Task Force out of the White House. What you're about to hear is you are going to hear from three individuals. Health and Human Services Secretary Alex Azar was there. He is going to introduce Dr. Ann Schuchat from the CDC. And then we're going to hear a reaction by President Trump to what Dr. Schuchat has to say. Here's that video clip.
Americans can find useful information at cdc.gov/COVID, COVID-19. And we're working closely with government and private sector partners to educate them about preparedness. Finally, we've begun working with Congress to secure the funding that we need. There are 5 major priorities in the White House request to Congress that the White House made on Monday. These priorities are: first, expanding our surveillance network; second, support for state and local governments work; third and fourth, development of therapeutics and vaccines; and fifth, manufacturing and purchase of personal protective equipment like gowns and masks. As chairman of the President's Coronavirus Task Force, I'm committed to providing regular updates from our coordinated interagency process. We've had our top public health leaders, like those joining me here today, speaking to the media many times per day to inform the American public. The Trump administration is going to continue to be aggressively transparent, keeping the American people and the media apprised of the situation and what everyone can do. With that, I'm going to hand things over to Dr. Ann Schuchat. Dr. Schuchat is the senior career official at the Centers for Disease Control and Prevention, the principal deputy director, with an over 30-year career at the CDC in public health and as a member of the United States Public Health Service Commission Corps. So Dr. Schuchat, I'll turn over to you.
Thanks so much, Mr. Secretary. As you know, this has been a difficult and challenging time, and our hearts go out to the individuals who have been directly affected by the virus and to all those who have been working tirelessly in responding to it. Our aggressive containment strategy here in the United States has been working and is responsible for the low levels of cases that we have so far. However, we do expect more cases. And this is a good time to prepare. As you heard, it's the perfect time for businesses, healthcare systems, universities, and schools to look at their pandemic preparedness plans, dust them off, and make sure that they're ready. And we have lots more information at the CDC's website and in partnership on how to do that. But it's also a really good time for the American public to prepare and for you to know what this means for you. The coronavirus that we're talking about is a respiratory virus. It's spread in a similar way to the common cold or to influenza. It's spread through coughs and sneezes. And so those everyday sensible measures that we tell people to do every year with the flu are important here. Covering your cough, staying home when you're sick, and washing your hands. Tried and true, not very exciting measures, but really important ways that you can prevent the spread of respiratory viruses. So the trajectory of what we're looking at over the weeks and months ahead is very uncertain, but many of the steps that we have taken over the past 15 years to prepare for pandemic influenza and our experience going through the 2009 H1N1 pandemic of influenza remind us of the kinds of steps that our healthcare system, our businesses, our communities and schools may need to take. We're in this together, all of government, the public and the private sector, and the CDC wants to make sure you have the best information available every day. Thank you.
So that was the message, Jill, coming out of the White House via the CDC Principal Deputy Director. We're in this together. However, she did warn that the spread of COVID in the United States was inevitable.
Yes, she did say that we would see more cases at that point.
Very calm, by the way. I look at this and I go, my goodness, the message that she just gave out was so calming, so reassuring, yet so factual.
And with concrete measures of actually how to help prevent it. Now, again, that was with the knowledge that we had at the time, and things began to evolve. At that point, they were saying masks aren't necessary. Later on, they said that masks were necessary.
Yeah. So later on in that press conference, the reporters are going to ask President Trump if he agrees with what Ann Shukat just said, which is that the community spread of the coronavirus is inevitable. This is
treated. Nobody knew anything of.
This is how the president reacted to his own health official.
Nobody had ever heard of anything like this, so it's a much different situation.
The rate of mortality.
Thank you. So, let me ask you this.
Yeah, go ahead.
In just the course of the last couple of minutes, you have disputed some of what the officials that are working in your administration behind you have said about the risk of coronavirus and its spread. Do you trust your health officials to give you good information, or do you trust your own instincts?
I don't think I have. They've said it could be worse, and I've said it could be worse too. I also think, no, I don't think it's inevitable. I don't think it's inevitable. I think that we're doing a really good job in terms of maintaining borders, in terms of letting people in terms of checking people. And also, that's one of the reasons I'm here today, getting the word out so people they'll know. They're going to know. No, I don't think it's inevitable. I think that there's a chance that it could get worse. There's a chance it could get fairly substantially worse, but nothing's inevitable.
So you're not.
Nothing is inevitable. I think the data shows that he was wrong. I think the data and the numbers show that his lackadaisical attitude about this was completely wrong. And it's worth noting that after that press conference, you don't hear from Dr. Messini out of the CDC. And
actually, you don't hear from anyone out of the CDC at the White House task force after that.
Yeah.
The person who is addressing the infectious diseases angle of it is Dr. Anthony Fauci from NIAID.
Yeah, and so let's talk about Dr. Anthony Fauci. So let me go back to the slide that we were showing you, and that's a great transition, Jill, to go to. So on July 9th, just last month, Dr. Anthony Fauci from the National Institute of Allergy and Infectious Diseases, he said, as a country, when you compare us to other countries, I don't think you can say we're doing great. I mean, we're just not. If there is one person, Jill, who still the public trust by a large majority, poll after poll show that Dr. Anthony Fauci continues to have the trust of the American public. But lately, he has been more contradictory about not only what the president has done, but what the president is saying. And certainly that has been noticed by the White House. When you look at the headlines that are coming out from Washington, D.C., where the White House is now directly trying to belittle at times, criticize at times, and even try to strike down his moral legitimacy in the eyes of the public, as you can see from these headlines.
And those are from July, correct?
That's correct. These are all July headlines, and it is worth noting, when we were preparing this presentation, this was just something new that was coming on over the last 2-3 weeks, as Dr. Anthony Fauci has been testifying on Capitol Hill, and he's been more blunt about whether or not the United States and the federal government's response to COVID has been good or not. He's been forthright. And of course, also, again, we didn't put this into the slide, but we are approaching the start of school. And that's been the other issue, that we're not going to talk about this, but it does show the messages that are mixed coming out of his health officials and out of the White House. And that is that Fauci expresses concerns over schools opening up again, whereas Donald Trump, what he just wants is for the economy to rebound. And to do that, people have to go back to work, kids have to go back to school. Okay, so you're going to talk about Dr. Anthony Fauci in just a few minutes, because he hasn't been perfect. And early on, he added, Jill, to the confusion of what people should do to stay healthy when it comes to the mask issue. You'll address that in just a few minutes. But I guess this sums it up, right, Jill? We don't know what we don't know.
Right. And so now we're going to transition into the evolving understanding of the epidemic, of this actual SARS-CoV-2. So we don't know what we don't know about the virus and what the virus does to the body and how it is transmitted. So as we have been able to observe the virus in people and observe the spread of the virus, the scientific community has gained more knowledge about it. But when you read articles, scientists are still, and doctors are still quick to say, there's still so much we don't know. So if you want to go to the next slide, one of I think the key places to start is how we measure just how deadly this virus is. So what scientists have settled on, the scientific community, is basically the infection fatality rate. So how do we figure that out? That's the proportion of people with COVID-19 who die from the disease. That's what it tells us. So this particular measurement attempts to incorporate both asymptomatic and undiagnosed cases. So the slide that we showed you at the very beginning of the presentation, those are actual diagnosed cases, people who've gone to go get their nose swabs, or they also incorporate people who have gotten the antibody test. But there's a whole swath of people that have the disease and are either asymptomatic, or their symptoms are so minimal they don't even realize that they have it, or they think it's another disease. So they don't really take it very seriously. So the fatality rate tries to do is estimate the total number of COVID cases, including the asymptomatic and diagnosed cases. So essentially, this is an estimate, but it is a better estimate of just how severe this condition is, as opposed to a case fatality rate, which does not include asymptomatic and undiagnosed people. So right now, what the CDC is working with, the estimates, are 0.5 to 0.8%. So that essentially means that 0.5 to 0.8% of the people who get COVID-19 die. So that's under 1%. And there are other scientific communities that have confirmed similar numbers. Essentially, it's a range. So this other one from the London School of Hygiene and Tropical Medicine is 0.5 to 1%. So that's what way we typically use to look at just how deadly it is. And some people will try and compare that to the flu, which, if you can go back to the other slide, Israel, the previous slide. For the flu, the case fatality rate, because I don't believe there is a measurement of the infection fatality rate, the case fatality rate is 0.1. So again, it's a different measurement, and the case fatality rate is typically a little bit higher than the actual infection fatality rate, because again, case fatality does not include the estimates of people who have it but aren't tested for it. So some people have tried to compare this to the flu. Number one, it's not an apples to apples comparison. And even if it were, the infection mortality rate for COVID-19 is either 5 times or 10 times higher, because again, you would be comparing 0.1% to 0.5% or 1%. The other thing that has contributed significantly to the spread of this virus are the silent spreaders, which essentially are people who are pre-symptomatic, so they are infectious before they show symptoms, asymptomatic, which means they never get any symptoms, or mildly symptomatic, people who can still spread the disease because they don't know that they have it. They might have a stuffy nose or a cough or feel lethargic or have tummy issues, and they don't really, it doesn't impact their life significantly, so they just kind of go about their business, and they're still able to spread the disease. So early messaging around COVID-19 was that you couldn't spread it if you didn't have symptoms. But as early as January, scientists had evidence of silent spreaders. There's a case study out of Germany of a woman who had done a sales call at an auto parts plant in Germany. And she went back to China, thought she was experiencing jet lag, didn't really think anything of it. And basically multiple people at the auto parts company ended up getting COVID-19. So not only did they confirm that silent spreaders were a possibility, they also within that study confirmed community spread as well there, because people who had no contact with that woman ended up getting COVID-19 from other people. So this whole idea of silent spreaders and taking the issue seriously of asymptomatic people being able to transmit COVID-19 was downplayed for months. Even as recently as June, the WHO, when asked directly about silent spreaders, disregarded this as a possibility. Now it's pretty well widely regarded that people who are asymptomatic can spread the disease. So how many people, can you please go back? How many people who have COVID-19 are actually asymptomatic? There was a recent study in the Annals of Internal Medicine that put the percentage at about 45%. They looked at differing populations. So they went into 4 different prisons, and they went into retirement communities and convalescent homes, and essentially were able to test the blood of people to see how many of the people actually had the antibodies to COVID-19. And basically looking at all those different groups came out with an average of about 45% of the people who have COVID-19 are asymptomatic. Then there's the issue of pre-symptomatic spread. So right now, the conventional thought is that if you do end up showing symptoms of COVID-19, the 2 days prior, you are infectious. So that's one big part of the contact tracing, is that when someone calls you, when you actually get a positive test, they want to know who you were in contact with the 2 days prior, so they can alert those people, hey, you know, you were potentially exposed to COVID-19, and basically let people know that they might have become infected. So the whole idea of silent spreaders contributes to the confusion over masks. And initially, when all of this was getting started, the big concern was the potential of overwhelming of hospitals and wanting to protect healthcare workers. So here's a tweet from February 29th of the US Surgeon General saying, seriously, people, stop buying masks. They are not effective in preventing the general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them and our community at risk. So the focus was on protecting healthcare workers, but he included in here that they're actually not helpful in preventing the general public from getting infected. So that contributed to the confusion when people started turning around and looking at scientific studies of how masks actually can help. People were saying, well, wait a minute, that's not what you told us before. So then fast forward many months to July 20th, the Surgeon General basically was supporting the administration's change of tune, saying that the whole administration is now supportive of masks.
And it's pretty interesting how there was such a sudden reversal in public health risk communication, because certainly now the issue of masks continues to be one of those, it continues to be a myth that people are still fighting for. I mean, it really has split down the middle when it comes to policy and politics, whether you wear a mask or not in public. And we've all seen the videos of people who refuse to wear a mask, and sometimes they in public. It has become quite controversial. I never thought that wearing a mask in public for public health reasons would become controversial, let alone it has now been part of case law. There are actually cases where, here in Palm Beach County, the county mandated that people wear face masks in public. And there was a group of people who sued the county saying that that was unconstitutional. And it was a judge who ruled the Constitution doesn't protect you from spreading COVID to other folks. It's interesting.
And that's also part of what has gotten lost in the messaging about masks, is essentially, when I wear a mask, I'm protecting you. When you're wearing a mask, you're protecting me, because it essentially is minimizing my ability to spread COVID to you by my face being masked. So either people are choosing not to hear that, or they're not actually getting that message. And so your point, Israel, a few minutes ago, there have been, people who watch public health communications who say this is one of the most sudden reversals in public health communications that they've ever seen. So it certainly is a sign of the times that this is getting very concerning, and the spread of this disease is very concerning, and that we all need to try and do our part to prevent the spread. The other thing too that I think is worth noting is that part of this plays into the conspiracy theories, because there are some of the conspiracy theories that relate to masks. And I think it also speaks to the issue of mistrust, because people not only mistrust the media, but there is a whole group of people who mistrust the government as well. So, and in some respects that's understandable when the government is asking you to do something. But at the same time, I think people owe it to themselves to ask, what is the reason why they're asking us to do this?
Right. And with that, we talk about this is the reason, right? Because it is more than a respiratory disease.
Right. So that's one of the also parts of this too, in terms of our evolving understanding of the disease, that, there were some comparisons to the flu, which this disease is nothing like the flu. It's a completely different virus. It kills at a higher rate than the flu does. But it also, we as scientists have studied it and how it actually attaches to the different compounds within our body. It not only impacts the lungs, but it also impacts the brain, the kidneys, the liver, and the heart. So people who do get this disease and who get a serious form of it will be living with the consequences of the organ damage for the rest of their lives. So there is the mortality, which is obviously people who die, but there's the concept of morbidity, which is how it negatively impacts your lifestyle going forward. And that is very real. So to be able to prevent the transmission of this disease and the morbidity and the damage to people's lives going forward is very important. The other thing that has been observed about COVID-19 are the vascular issues. So in New York, they have seen more people, or not now, but when the epidemic was at its height in New York, they were seeing more people, and younger people to boot, going to the hospital with strokes. And they didn't even know they had COVID-19. They didn't know it until they got there and got tested. So essentially what they've seen is it causing blood clots. And then it can also cause constriction of blood vessels, which has led to things like COVID toes. So that is another major side effect of this disease. And lastly, gastrointestinal issues as well. So some patients that's their first presenting symptom is a gastrointestinal infection. And coronavirus has actually been found in feces. So yes, so basically improving the communication about the disease, that it's not just a respiratory disease, but at the same time, not allowing that to lead to confusion, because the knowledge of this disease is continuing to evolve.
So with that, let's talk about the evolution of media consumption, because awareness of COVID can either provide good or bad information. And so that leads us to the politics of COVID. You know, there was a study done by the Harvard Kennedy School. They did a misinformation review, and it was published in April. The research was done in March, by the way. And they found that above and beyond political party, mainstream media broadcast use, so for example, NBC News, CBS News, correlated with accurate information about the disease's lethality. And then mainstream print media use, so think of the Wall Street Journal, the New York Times, correlated with accurate beliefs about protection from infection, whereas conservative media use, so Fox News, Rush Limbaugh, social media postings, there is this idea that correlated with conspiracy theories, including believing that some of the CDC were exaggerating the seriousness of the virus to undermine the presidency of Donald Trump. And that's when, you know, when you heard earlier today, whether it was Dr. Shukat or Messinier, or even now, Dr. Anthony Fauci, you have seen these conspiracy theories that Fauci is just trying to undermine. We're going to look at one docu video from one doctor who has spread some conspiracy theories out there. And, you know, she has even gone as far as to say that Anthony Fauci helped to create the virus. So it lends to this credence that wherever you get your information, that's what you're going to believe about COVID-19. Any comments on that?
Yeah, and just to stick with the slide as well, the social media over on the right-hand side, that actually correlates with not believing, like people who consume more social media, that correlates with not believing that hand washing or social distancing actually work as a way to prevent the spread of the virus.
Here was a Pew Research study that was done on journalism and the media. And they show similar findings with regards to Republicans and Democrats, what they believe in COVID. So this is the political mindset of what's going on out there. When you look at half of Americans who rely on the White House for coronavirus news, they think the crisis has been overblown. And so the majority think it's been made to be a bigger deal than it really is. Whereas nearly 3/4 of those who turn to the president and the White House task force for coronavirus news say the media have exaggerated the risks. Any comments?
Yeah, I mean, I think what you just said, it just speaks to the politics of it. And then they basically have these 5 categories of where you get most of your SARS-CoV-2 news. So the Trump task force, local news outlets, state and local officials, national news outlets, and public health organizations. So, yeah.
Where you get your news matters.
Right.
Right? Yeah. So that leads us to conspiracy theories, because Jill, this area is where I think the most disservice has been done to the public's awareness of what is and is not COVID. And I think the Bakersfield doctors are a good example of when health officials speak up and they say something that, as we're about to see, it's not supported by science, it's not supported by
right. And I also want to set this up as well too, is that very understandably, people were getting frustrated with the stay-at-home orders or suggestions. There are very real concerns about the economy and what stay-at-home orders have done to the economy. And so it makes sense that people are wanting to try and get as much information as humanly possible to make the best decisions for their families. So it's within this whole vacuum, essentially, that people are potentially more likely to want to listen to something like this, and they see doctors who are legitimate, wearing their scrubs, who say they've tested all of these people and are making these claims. So that's sort of like our human nature, is that we're wanting to try and make sense of this thing that is so big and so impactful and so concerning. And with the advent of social media, because it used to be that the newspapers and the TV stations and basically the mass media, they were the purveyors of the information. They edited it for us and they told us what they thought was most important and what they needed to know. Now, essentially, the gateway for information is huge. So some of that information in this bigger gateway is good, but it also opens up the possibility for untruths to be accepted as truths, and then furthermore to undermine the confidence in people with decades of experience in public health who have prepared for a moment just like this, which is a worldwide pandemic, to be undermined and not believed.
Okay, and with that, here is a report by the Washington Post on the Bakersfield doctors.
And I say, do we need to still shelter in place? Our answer is emphatically no.
Dan Erickson and Artem Masihi are rising stars in the conservative landscape for pushing to end California's stay-at-home order.
I can't tell you how many different people sent me your videos.
The 2 owners of a chain of urgent care clinics started offering COVID-19 testing at their facilities in early April, saying they conducted over 5,000 tests by the end of the month. Their road to the spotlight starts April 22nd, when they called a press conference to share a wide array of conclusions, including a false claim that the flu has a similar death rate compared to coronavirus.
It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home.
They also claim that isolation weakens the body's immune system and puts patients more at risk. In fact, infectious disease experts say that continuing social distancing is imperative to slowing down the spread of the virus.
So quarantining and social distancing is worse for us, you're saying?
It decreases your immune system. You can't build an immune system by, if someone has a reduced immune system, you hide them away because they can't build an immune system. If you have a normal functioning immune system, you need interaction.
You think people are worrying too much?
Of course they are, but that's from media telling them to.
Erickson and Masihi's comments were instantly debunked and condemned by scores in the medical community. Their video prompted a rare joint statement from the American College of Emergency Physicians and the American Academy of Emergency Medicine, calling their claims reckless and untested musings. California public health officials also urged residents to continue staying at home.
We want to reiterate, now is the time to remain very vigilant and stay at home and practice social distancing.
Still, early coverage of the pair caught the eye of many on social media, including Tesla's Elon Musk, who tweeted a link to their YouTube video to his over 33 million followers. The link, posted by Bakersfield TV affiliate ABC 23, garnered over 5 million views before ultimately being taken down by YouTube for violating its community guidelines. The interview still remains posted in full on the station's other platforms, like Facebook, and is still being uploaded and reposted by other YouTube users. The pair has since appeared on Fox News with Laura Ingraham.
You struck a nerve with those videos. Why do you think, very quickly, Dr. Masihi?
I think we can relate to the American people.
Other conservative commentators on the network have also rushed to their defense.
The only justification for taking it down was that the two physicians on screen had reached different conclusions from the people currently in charge.
That was nonsense word salad on the part of YouTube. These guys are medical doctors. They're scientists. For heaven's sakes, they didn't say anything that was really disputable.
Erickson and Masihi join a list of doctors who have appeared on Fox News only to have their claims quickly debunked. The network has also received backlash for claims made by TV personalities Dr. Phil and Dr. Oz, neither of whom are infectious disease experts.
45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools, but we don't shut the country down for that.
So that was the Bakersfield,
And
that was Bakersfield doctors. And then, Jill, we had Plandemic.
Yes, so Plandemic came out in early May, and we're not going to play it because it's very long. And it has actually also been removed from social media sites. But essentially, it's a short film featuring a researcher named Judy Mikovits. And she makes all sorts of claims in her video, including that Dr. Anthony Fauci allowed millions of people to die of HIV/AIDS in the 1980s by holding up publication of research. She says that she's not anti-vaccine, but has clear associations with anti-vaccine groups. She believes that SARS-CoV-2 is not naturally occurring. And while she says it wasn't created in a lab, that it came into being in a lab in the United States, actually. So she also makes a claim that wearing a mask, quote, literally activates your own virus. She says you're getting sick from your own reactivated coronavirus expressions. And if it happens to be SARS-CoV-2, then you've got a big problem. So she contributed to the mass confusion that essentially you can get sick from coronavirus by wearing a mask. So this video made the rounds, and it was roundly debunked by doctors and scientists and journalists. And if you go online, there are wonderful articles that basically take her points, point by point, and says why she's incorrect about the statements that she makes. But I was first texted the video by somebody, and then the next day it was all over social media. And it was sort of a similar thing where with the Bakersfield doctor, people were up in arms because it was removed. And it was the same thing with this, people stating, well, we'll see how long it actually stays up before someone gets removed or someone removes it. So there's this idea of censorship too, which obviously censorship is concerning for people. So it plays more into this whole mistrust of the system.
Well, and let's be clear. When it comes to censorship, only the government can censor. Private entities can do whatever they want with their social media platforms. It is a company. It's not owned by the government. But the other thing, too, is that, you know, these social media platforms have community standards of speech. Now, it's wide. It's certainly, you know, you see a lot of hateful speech protected by the First Amendment. But when it comes to misinformation, the reason why these social media platforms removed these videos was because they weren't honest. They weren't truthful, right? It didn't, the science and the data didn't back up what these people were saying. And those are the rules of social media. Now, did it add to the confusion? Absolutely. And as this chart shows, Jill, the pandemic misinformation still spread like wildfire among these groups that are either far right or right wing related organizations.
Right. So this is a list that was put together by this woman named Erin Gallagher of the groups that were the most highly associated with pandemic on social media. They also did the same thing for Dr. Judy Mikovits, who was the protagonist in the video. So, and it was a similar list of people, or a similar list of groups. Like Israel said, that they're far right-leaning groups and very interested in conspiracy theories, and potentially are in the business of disinformation as well. So if you go to the next slide, this is just more of a graphic of where you can see how her video was associated with these different groups.
And this is just the web, right? This is how it just went. This shows, in graphic mode, how quickly just this web of conspiracy sharing just spread.
Right. And, for the people who were attending this class, perhaps you actually witnessed all of this on your own social media feeds, right, to see how often people posted and commented about this video before it was removed.
Sure. Absolutely. Here's a Pew Research Center a study when it came to conspiracy theories. Most Americans had heard at least a little about the conspiracy theory that the COVID-19 outbreak was planned.
Right, which is essentially, by the name, you can figure it out, plandemic. So that's a sizable portion of the U.S. population that had actually heard something about it.
I mean, that's like, 72%. And among those who got the news about COVID-19 on social media, look at that number. That's 80% who had heard about it.
Right. Right.
Are on social media.
And then furthermore, if you go over to the second graphic, the number of people, or the percentage of people who thought it was either definitely true or probably true, was 36%. So just over a third of the population are inclined to believe that this was planned.
Right.
So that speaks to the level of trust that people have in our authorities.
And again, when you look at how the numbers separate when it comes to political affiliation, Republicans, or leaning Republicans, 47% believed it was definitely true or probably true. Well,
and then similarly too, just to point out, among Democrats, the total was 63% who believe it's probably not true or definitely not true.
Right. When we look at those who rely on President Trump and the task force for COVID-19 news, they were more likely to give credence to the conspiracy theories that the outbreak was planned by powerful people. And then those who get COVID news from social media, often more likely were to give credence to the fact that the conspiracy theory that pandemic was planned. And again, when you have this large number of people, you can quickly see how, family and friends posting on Facebook and retweeting, it caused a lot of confusion.
Right. And then the other thing too, just to note as far as the Trump task force, is one of the things that President Trump has repeatedly called the virus is the China virus. So even though that's a different theme from the plandemic video, it does speak to the nature of there being a concerted effort to send the virus here to the United States from China.
Right, and to harm us. So as we wrap this up, Jill, I think, as we said at the beginning, we want to make sure that people are informed. As former journalists, who we are still consumers of news and the media, here's how we look at it. If you want to avoid misinformation, you've got to expand your sources for news and information. Don't just go to one channel. Again, if you watch Fox News, it's okay. I worked at Fox News. I was a package producer for Special Report many, many years ago. So, go ahead and rely on Fox News, but watch CNN, watch other networks. If you read the Wall Street Journal, read the Washington Post and the New York Times. When it comes to studies, because there are so many studies out there, should you take this drug? Should you wear a mask? Make sure that whatever you read, whatever medical studies you read, they have been examined by others in that field. As the video pointed out, Jill, just because you're a doctor doesn't mean that you are experienced. You're an infectious disease expert. So you have to be very careful who also is making sure to hold these researchers accountable.
Right. And a lot of times what you'll see in the news, because I get most of my news actually from the newspapers. I prefer reading my news than actually watching news. So a lot of these people who were quoted, because newspapers have more space to include quotes and information, they will say, we're still learning, we still don't know this, or this is our best guess, this is our best estimate. So they are making it clear that not everything is black and white. So that's important, that there's still an element to all of this of needing more information. Yeah. And the last thing too with social media, I'll just go ahead and go on to that. One of the things I think is really important to note is that accuracy is not an important thing on social media by most people. And there's not a lot of detail and there's not a lot of explanation. So be careful what you consume on social media, because it's often meant to be shocking and salacious, to get retweets or repostings. And I know for me personally, my standard is that I only post news articles, and I've even seen some graphics that are supportive of masks that make really great points. But as far as the percentages of how much it actually prevents the transmission of novel coronavirus, but I wouldn't post it because there's no site, there's no actual reference to a study. So as much as I'd like to do it, I don't do it because I don't want to contribute to any misinformation. And I've tried to validate the information other places. And if I'm not able to validate it, then I'm not going to post it, because we all have a responsibility to not pass along misinformation. Absolutely. So
that's really good information.
We want to post trusted sources.
Finally, listen, being home, being safe, being healthy, that's what this is all about. As Dr. Ann Shuket said, we're all in this together. And at the end of the day, what we're really trying to do is we're trying to protect our family, our kids, our loved ones.
And our community as well, because we have to think about our community too.
Absolutely, absolutely. Because the economy, the health, the education, this is all now all encompassing. And we're going to get through this. We are going to get through this, but we got to do it in a way, as Jill just mentioned, that we just think about others, think about our community, think about the health, think about the information, and be patient. Be patient, because this is still evolving. We want to thank you, Jill. Thank you so much for doing this with me. This is so much fun. And I think after this, when we hit stop record, I'm just going to go out the door and then I'm going to give you a big hug. Thank you so much for watching. If you have any questions for me, there's my email address right there. I'm also the advisor of the Beacon Today, and we'll be covering the COVID-19 and coronavirus on PBA campus. So watch for those stories. And if you have any questions for Jill, I will pass along those questions to you. Once again, thank you so much, Jill. I really appreciate it. And thank you for your time.
Thank you for having me.
And thank you for watching. I'll see you around campus.